My name is Dr. Tiernan, and this is my wife Lucille. We're the owners of Jon Ric Medical Spa Day Spa and Salon, and in just a minute we're going to take you for a tour of the spa, and you'll see why it's such a special place. When we're done, we're going to be doing some procedures on patients, and you'll see what some dynamic things that we do here. So in this time, let's go inside and take a look around. In just a minute, we're going to take you for a little tour of what we do around here. Now, we're going to be setting up a library of procedures that we're going to be doing, we'll be demonstrating on the internet. And so this is the sequel to the first episode where we had a general tour. And what you're seeing right now is the entry to our salon and spa. And this is the brainpower of our salon, Allie. She's our manager. And from this point, she directs everyone to certain parts of the spa where we can do our procedures. And in the background, that you'll see our salon where we have 8 stations. All of these are engineered, or the architect put these together specifically for space and comfort of our clients. And behind me, you'll see our amazing products. Bumble & Bumble from New York. It's exclusive to this area, as well as Paul Mitchell and Goldwell products. But most interesting are the things I do. So I do Botox, and by the way, we're going to be shooting a little segment of our Botox, and you'll be seeing how easy it is, and it'll kind of allay some of your fears as we go along, that it's not so bad having a needle. You'll see the magnificent results, and when you come back again, you'll see the patient that we just did it on, and see the results after that. And this is Botox, and we're going to be injecting Denise's glabella, the number 11 that everyone talks about, the frown line. And you'll see results in about 2 to 4 days. And what this is going to simply put, what you're trying to do with Botox is relax muscles. Muscles are the ones that cause the creases. You'll see if she makes a frown right here, that's the old number 11. Okay, and this really involves 3 separate muscles that causes that constriction. And usually secondary overuse, usually people with a lot of expressions will get these creases as time goes on. So what you're really trying to do is relax it so you get a nice calm appearance, not the frozen look that you see on comic strips and comedian segments. So right now what we're going to do is Denise is ready. You can tell she is ready. She's smiling even, so it's not that bad. Can't be that bad. And so what we're going to do is we're going to start with a little Botox right in the center. And you'll see no expression on her face. She says it doesn't hurt at all. And so, but right in the center there. The trick to it really is massaging and having the patient go home and do some facial expressions for the first 2 hours, not to lay down for the first 4 hours. And you'll start seeing results in 2 to 4 days, and after about 2 weeks, you're going to see the full results. And see how happy she is? She says, I am so glad I came in here and got this Botox. Now, did that hurt, Denise?
Not at all.
If you can believe that expression. It probably pinched a little bit, but actually it's pretty rewarding. As you can see, there isn't a heck of a lot of bleeding going on. So this is one of our procedures. We also do things like Juvederm, Restylane for wrinkle reduction. If I was to do anything on her, I'd probably do some Restylane here and here, and that would fill in some of the lines around the outside of the lip. She doesn't have too much need for anything else. We also do some, with our multiplex, we also do some wrinkle reduction, which is a brand new laser on the market. It just came out in August. And what that's really for is for fine lines. You can actually get a lot of improvement around the crow's feet. And so that's the type of thing that we do in conjunction with things like Botox. So we have our Juvederm, Restylane, we have Botox, and we have our multiplex and Affirm. So what we'll be demonstrating next, because now she can go back to work without any problems, so there's really no downtime with Botox or any of the injectables that we use. So I would suggest if you are going to have anything like Botox done, make sure your physician has a lot of experience in it and that the product that they're using is fresh. So that's 2 of the most important things to do.